He's been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem. Designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advice. We'll give you expert advice you can rely on because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskaram. Welcome to Apollo 24/7's Health Hour. Health Hour is a feature which is devised to get the expert Apollo care to you, right in front of you, to your hands, where we've been bringing expert Apollo doctors to answer your queries live. Every Sunday, we've been having wonderful doctors sharing their experiences and guiding us through how do we deal with the pandemic. But today's session, it's going to be a different format, and it's going to be really exciting. I am eagerly waiting for our participants today. I hope you guys are also eagerly waiting to meet them. Today's session, I'm going to be inviting a few people who have fought over Corona and then who have come out victoriously. I don't want to call them survivors. I suppose they need a better name, a better introduction. So let me call them co-victors who have been victorious over COVID. तो हम उनसे बात करेंगे, उनका जर्नी उन्हीं से सुनेंगे कि उन्होंने क्या किया, कैसे डील किया और कैसे विक्टोरियसली बाहर निकले हैं. So we are going to hear from them, their journey from being infected to coming out clean of COVID. And also you can ask all your questions. We're going to talk to Dr. Sai Praveen Garu, who's going to be a expert, who's a pulmonologist and a critical care expert, who also is a COVID warrior and also a co-victor. So watch out for this interesting session where you can win prizes. I'm going to ask you a few questions. Health quiz is something that you can participate and win prizes from Apollo 24/7. Also, please be with us till the end, where I'm going to announce a few discount vouchers and gift coupons. You can use them on Apollo 24/7 app. So on this note, I would want to introduce my co-victors. ये बोला जाता है कि you never know your strength until being strong is the only choice you have. So I have these strong people who are going to join us today. Ms. Kanika Rao from Bengaluru, who's a legal counsel with a startup. Mr. Saidev Shah from Hyderabad, who's an entrepreneur. And Ms. Lalita Lama from Kolkata, who's a healthcare professional. Namaskaram and welcome to the show, Ms. Kanika, Mr. Saidev, and Ms. Lalita. Hello, Kanika. I can see you. And Mr. Sadev, namaste. Aapka swagat
Namaste,
hai.
ma'am. Yes, thank you.
Yeah. Can I also, Ms. Lalita, namaste and welcome.
Namaste.
Can we also see you, ma'am?
Namaste, Jhansi. How are you?
All good. So wonderful. As I was saying, you never know how strong you are till being strong is the only choice that we all have. So,
Yes.
Kanika ji, you being a lawyer, I think lawyers are, I feel that lawyers are epitome strength. So, how did you face this? What happened to you?
My mother-in-law was detected with this first, and she was not keeping well, but I was not showing any symptoms till now. And once she was tested positive, the first thing we did was to go to hospital and get ourselves tested.
Okay.
And till then, the results were out. We were home isolating till then.
Ah.
Yeah.
Okay. So, what were the symptoms that you experienced? And how did you know?
I just had sore throat, but except that I didn't have anything, not a single symptom after that.
That's it.
Yeah.
So ये तो confusion होगा ना, ये regular sore throat है या
Exactly.
COVID related है. So
yes.
How did you deal with the entire process of getting into the hospital, or who was there to guide you?
So my dad works with a bank. He's in Bankers Association. So he told me about Apollo's Kavach, the whole, what exactly is it and how to go about it. So we contacted, and thankfully we got a isolation center in a hotel. And I contacted them, and my the vitals were checked, and then I was quarantined there.
That's interesting. So I just want to tell my viewers that Apollo 247 or Apollo Hospital Group offers a program called Apollo Kavach, wherein you can access, in case you want to be home quarantined or you want a safe isolation place. Yes. People have a lot of doubts, Kanika, especially ये isolation centers कैसे होते हैं, अगर quarantine करना है तो कैसे होगा? How was your experience at the isolation center by?
So I was living alone in Bangalore, because as you're aware, most of the people have just left from Bangalore. So I was alone here, and I was visiting my mother-in-law. And when she got, tested positive, I went to get myself tested, and I came back home. And when I just figured out I have to go to Apollo, I went to the hotel, and it was just as you're going to a hotel. It's just in that one room. You are not roaming around just to be, keep others safe. But it was just as a good experience. I was in a hotel. The food was being provided 3 times, and the doctors were having a check on us. The daily calls were there. 2 times, the vitals were being checked. So yeah, I didn't feel that I was away from home. Yes, I was in there only.
So you were staying safe while being secure.
Yes.
Yes, right.
And not feeling lonely also, and somebody to take care of me as well.
Correct, exactly. And you could contact them always through Apollo Kavach program. Wonderful. Yes. So Mr. Saidev Shah, who's an entrepreneur from Hyderabad. Namaste, Saidev ji.
Yeah. Namaste, Jhansi ji.
जी, आपका तो completely different story है, ये मैंने समझा है.
Yeah.
So how did you understand? What were the initial symptoms?
Yeah. So basically, it all started off with my father, because he developed some fever, but he did not have any regular cold, cough, or any other symptoms, just some mild fever. And then all of a sudden we saw that he was getting breathless. So that's when we contacted the doctor and got him admitted in the hospital, and we got to know that he's positive. So initially we were a bit panicked, but then a lot of our friends came into our support. They were like, there's nothing to be worried about. You just have to quarantine yourself. So then we started picking up our clothes, everything, and everyone went into individual rooms at home itself. We didn't do anything. So then we just registered ourselves with Apollo 24/7, where doctors were just kept checking up on us every day, twice at least. And we were using pulse oximeters as advised by the doctors, and keeping our vitals checked every 2 hours. And we were just in the quarantine enjoying our food.
घर में ही थे आप?
Yeah, we were all in the home. And then after a week, I started developing some symptoms. Like I started getting fever, I started having a backache, and I started getting some severe chest pain. So that's when the doctors decided that I should be admitted based on my symptoms. And within 5 days, I was out of the hospital and back home, and I completed my quarantine again at home.
Congratulations. बहुत ही positive वाइब्स मिलते हैं कि जब सुनते हैं कि you have dealt it so well and ये 5 दिन में आप लोग recover करके भी आगे, क्योंकि इतना डर है बाहर, इतना panic है. So these stories become very important.
Yeah, true. But the main thing is that we need to keep doing our breathing exercises as advised by the doctor. Keep your mind focused off the corona thing, because you get a panic mode inside that, oh, I'm having a disease which might not be curable. So it's nothing like that. We just have to stay positive and keep our mind busy with something else. That's it.
Okay. अच्छा, तो एक और बात पूछना था. आपने बोला था कि अपोलो 24/7 का ऐप जो है, that's what you've been using, Mr. Seth.
Yes.
And how did you consult the doctors? This is not the Kavach program which Kanika ji बोल रहे थे, वो नहीं.
Yes. So basically, there is this Apollo home care package wherein they call you and check on you and the doctors. So when I had started developing symptoms, I booked a appointment with doctors online, wherein they examined me through my webcam and everything, and then they
so it was an online consultation.
Yes, it was an online consultation with the senior doctor. I think Dr. Sai was there. He was one of the persons I consulted, and then he gave me a prescription saying that you better get some blood tests and get an X-ray fast, so that we get to know what's happening with you. So and then I went out.
Advised by a doctor at the right time has actually saved you.
Yes.
That access to the doctor.
Through online.
Online, that is through Apollo 24/7 has actually helped you.
Yes, ma'am.
So how did you spend your quarantine? What are the things that you did?
So most of the time, I at least used to exercise for half an hour 3 times a day. I used to do all the breathing exercises. I used to do spirometry. I used to do everything. So I made sure that even when I was in the hospital, I made sure that I didn't want to get into oxygen. I had that in my mind that I will not require any oxygen. So all the 5 days, I was the only patient who was there without oxygen. So I was continuously walking around. I was doing anything possible to keep my lungs good, breathing and doing everything, exercises and all that. And rest of the time, I spoke to my friends. I watched some movies because I had my phone access. So I used to do that to get this quarantine over.
Okay, so your attitude basically helps you, right?
Yes, definitely. Your mindset helps you a lot in this. Yes.
Thank you so much, Mr. Shah. And Ms. Lalita Nama, who's a healthcare professional and who's been actively working. And how did you deal with this, Ms. Lalita, and how did you face this? You are muted, Ms. Lalita. Can you unmute yourself? We can't hear you.
Yes, I'm audible now? Yeah.
Yes.
Hi, Jhansi. Actually, being a healthcare worker, we are always being sensitized, like how you would handle this and how to take precautions and what is it all about. We have all the details and all, but also like we have been always sensitized that how, in case you get into how cautious you will be about your symptoms and also and what you should do. So the moment I felt for me, it started only with a little bit of sore throat and mild chill and body ache. So I could have been a flu also. So immediately it happened like while I was at work. So I went to my medical officer. He put me into some antibiotic. So he said, just watch for it and all. Maybe it's just a common flu and you go home. So I went back home, isolated myself completely. So he had told me, like, you take antibiotic for 4 to 5 days, and if the symptoms does not improve, we'll go in for a test. So on 5th day, I found that no, my symptoms were not improving. In fact, I was getting fever.
So
I went to the hospital
till the time that you
isolated, because that is yes, because that is what we should be
aware, and that's your responsibility.
Yes. So that's a responsibility which you have for your community and also for your family. So after 5 days, I went back to the hospital, got myself tested. So my symptom was my lung was infected, and I was also positive. So because of the symptom, I was hospitalized, and I stayed in the hospital for.
How long were you hospitalized?
I stayed in the hospital for around 6 days because I was continuously getting fever, and I was having some stomach upset and nauseous and all. So post 6 days, my fever subsided. I did not have any fever for 48 hours. So they shifted me to our another unit, which is an isolation unit, which is outside the hospital. A hotel turned into a hospital. So where a mild, somebody who's a stable patient can be shifted there. So I was given a room, I was isolated, and I continued being there for next another 9 days, where I was like checked with my doctors and nurses, and everything was taken care. So post 14 days, I came back home and I've resumed my work. That's
so Kanika and Lalita, both of you had come out of, you had stayed in the hotel turned into COVID quarantine session. So Ms. Kanika, can I also, I don't see Kanika's video. I think I've lost her, but I'll see if we can get her back in. Ms. Lalita, how did you spend your quarantine at the stay which is converted? You know, hospital, जैसे Mr. Sadev ने बोला है, that's a different experience. So, ये जो hotel वाली quarantine है, how did you spend your time there?
Hotel quarantine is actually how Kanika like referred before. It's just like an hotel. You go and you, the only difference is that you've been taken care by a doctor and a nurse over here. You stay inside a room, you have your own like space, and you're taken care of by your physician. Twice a day, you are taken care by your nurses 4-5 times a day, whenever you call them. And after that, you just take rest. That's what my physician told me, because I used to feel very sleepy. He said, sleep as much as you can. Okay. And yeah, so you feel
comfortable, you mean to say, that's taken care of.
Yes, you tend to get a little drowsy, but then that's what actually, the more you rest, the faster you recover. And I
heard that Kanika ji और आपने तो अच्छा ही टाइम इस्तेमाल कर लिया है. कनिका जी तो योगा और प्राणायाम, ब्रीदिंग एक्सरसाइजेस प्रैक्टिस कर रहे थे, और आप and आप books भी पढ़ते थे, ये मैंने सुना.
Yes, I used to read books and a lot of Netflixing. So that is how it was. It was more like a nature's way of giving you a break. You have been doing so much. Just take a break now. Be with yourself. Think positively. Do breathing exercises. Meditate. So okay. and it's you can just take it positively, just like a viral. Like it's a little bit more severe than a viral, and nothing more than that.
Okay. So Kanika ji, what was your experience there?
It was good. So my mother-in-law actually joined me in the same room where I was, because she was all fine. She was discharged from hospital. So even she was with me. So for those period of time, I was actually like reading all the books. I've been procrastinating. No, I will read it later. So I read all the books. I was working actually. I didn't even take a leave. I've taken just 2 days leave because the day I was actually feeling really unwell. Otherwise, I was on call with my office. I was working as well. I've not taken leave. It was just that when I was feeling bit, the medication, because the medications were a bit heavy. So that was the time I was taking a bit of rest. But yeah, I was working as well. And me and my mother-in-law had made a rule that, when we'll get up, we'll do full-time yoga. Then we'll do some breathing exercise. And, I've done 6,000 to 7,000 steps in that room only. So yeah, yes. In that particular room, I used to just walk. I would read. So we have done that as well. Yeah.
And my mother that gives us actually you deserve a pat on the back and we deserve a kick on our backs. Fitness ke liye kuch to karo. And Mr. Sadev, what were you doing and how did you deal with the quarantine period?
Yeah, so most of us, like as Ms. Kanika was sharing her experience, even we were on calls. So whatever business was there, we were taking care of it because we had to keep our lives going and we had to keep our mind engaged. We didn't want to think that we were sick somewhere. So it's just that we are in a room for some days and we have to keep our lives running. So just like how she suggested, even we in that room itself, we used to walk. We used to walk as much as we can, at least for 15-20 minutes in every 6 hours. We used to keep ourselves walk. We do walking. We used to do pranayama, deep breathing exercises. Then a couple of exercises which our doctors had shown us. So we used to do that. So that way most of my time, like 2-3 hours in a day used to go in exercises only. Then rest of the times we were on calls and everything. But
तो अभी भी एक्सरसाइज का जो रेजिमेन है वो चालू है या वो बंद हो गया है?
no, it's still on. I'm still doing it, and I'll be doing it for at least another 3 months until the vaccine comes at least.
That's nice. See, this very victorious smile itself is giving me so much of positivity. कि ये walk through हो जाएगा. I can deal with this करके एक मुझे strength मिल रहा है आप लोगों को देखते. तो एक बात बोलिए, how did your families deal with this? Tanika, what was the worry from your family or your friends, and how did they deal with it?
With my family, because my mother-in-law was tested, there was a bit of panic, and she being, an asthma patient, so that was a bit of worry for us. So that's what our doctors had suggested, that she should be hospitalized. She was hospitalized, but for me, they said there is nothing. So I was not, showing any symptoms. They just asked me to take ample fruits, water, and the medication that was given by my doctor.
Oh.
Apart from that, nothing. But my mother and my father being, away from me, they panicked a bit. Every day they would call me, like after half an hour, they would call me like, "Are you okay?" When my friends got to know that, how's it going? So, I think first few days were a bit of, just thinking about how to go about it. But after when, things were on their place, we were all fine. My family also understood, that everything is okay. You just have to take a good care and good rest at that point.
Wonderful. तो सदैव जी, आप ने बताया कि आपके फैमिली मेंबर्स, आपके फादर भी थे, but how did you protect, or how were your family members, and what would you say कि ये preparation या awareness कैसे deal किया जाए? What is that one thing that you would want to suggest?
Yeah, so basically the day we got to know, it was like night, 10 o'clock. We couldn't buy anything, we couldn't do anything, so we were a little scared, we were a little panicked. But then isolation, so we had already done, we had already moved to individual rooms and everything. But the next day we had some of our workers who helped us out. We made them a list. Our friends helped us in the calls. They told us that this is what is required. You need to have basic hygiene stuff. You need to have some sanitizer with you. You need to have gloves so that you access the food which is coming to you and everything. So we always used to keep those things, and we made a list and we gave everyone their individual portions. So my worker used to wear face mask, gloves, and face shield when he was serving us the food. He used to put it on a table outside, and we used to pick it up from there, and he used to sanitize the entire area once I've picked up the food from there, so that he doesn't contract anything. And our doctor's advice were that we should be on basic multivitamins.
Sorry to interrupt you. कि ये जो आपने बोला है कि जो सैनिटाइजेशन के लिए इक्विपमेंट जो चाहिए, वो पूरे आपको पहले से आप घर में you had them, or did you get them from Apollo?
So we had like one set of it, but now we required 3-4 sets of it. So we used one of our drivers, and we asked him to just buy everything and drop it outside the house, and we'll just go and pick it up and we'll distribute it among ourselves. So that's how we did it.
Yeah.
For the first time, that panic will be there.
कोई किसी के पास ड्राइवर नहीं है, तो मेरे ऑडियंस को मैं बोलना चाहती हूँ कि अपोलो 247 ऐप में आप फार्मेसी ऑनलाइन ऑर्डर कर सकते हैं, 2 स्टेप डिलीवरी भी हो जाता है. स्पेशली विद कवच प्रोग्राम, ऑल ऑफ दीज आर जो आपको चाहिए, आपको दिमाग में नहीं आ सकता एट दैट पॉइंट, बट एवरीथिंग इज रेडी इन द कवच किट. So just a point that I wanted to add.
Yeah, absolutely. Yes. Yeah. So in fact, a lot of people say that if you're positive, your relatives will try to be like, oh, you're positive, and they'll try to give you that negative feeling. But a lot of our friends have actually called us up and tried to get to know things. Ki, Arey, you're positive, please help us out. We don't know what to do. We don't know how to take it forward. And then me and my brother, we made up a list. We circulated them on WhatsApp that this is what you need to do. Don't worry, nothing will happen to you. And my brother and mother just got fine by their own. They didn't have to take any medicines also. They were just at home in isolation, and they got well and they tested negative. So it was just nothing. Just that for some people, you might have to hospitalize based on your symptoms. Otherwise, it's just normal.
Small population, again, their symptoms and their health conditions.
Yes.
Ms. Lalita, our last word from you. How did you deal with the entire pandemic, and what is that one thing that you would want from people, or what is that one call that you would want?
Well, for the entire pandemic, for us, it is totally different. Being a healthcare worker, like it's absolutely different for us because we know what it is. We know what to take, how to deal with it. And also like about our family, like we are basically, when I was infected, like when I got my results as positive, it was never, I was not scared. Neither were my colleagues ever scared to come to work, but only scare was about our family. Like, I hope we don't infect them. So we were all very taking a lot of precautions that we should not, how we should come back and how we should sanitize ourselves. And every one of us, we have kept ourselves isolated so that we don't infect anyone else in case we have, I have got infected. So the moment I came to know that I'm having a little bit of symptoms and all, I isolated myself and all.
Wonderful.
So there's nothing to be worried about and all. It's just like a viral fever, maybe a little more severe. So it's only thing. One thing I would like to say is, like, we should not discriminate the family members when someone is found positive and all. So we should.
As such, we've been dealing with so much in our own lives, and this
Yes.
is the last thing that you would want from people.
Yes, it should be all about like social distancing, but not about social discrimination.
Perfect.
Yes.
And there are a lot of people who are appreciating you on the live chat. Please take a bow, and very, very positive hearing from you is what the live chat is buzzing. Congratulations to all of you. And I will take a few questions with you guys later. Kindly be available with us through the live. I'll ask the questions that people are asking. Thank you so much. Kindly switch off your videos for a while now. Yeah. So, ladies and gentlemen who are watching the live chat, I can see all your questions. I will take all these questions in a while. But right now, I am going to invite a doctor who's a frontline warrior, who's a COVID warrior, who's been taking care of patients, who's been this warrior, and is also a co-victor. Dr. Sai Praveen Garu, Namaste Andy, who is a pulmonologist, a critical care specialist, an internal medicine specialist, who's been working with in the field for the last 20 years, who's working with Apollo hospitals. Namaste Andy, Sai Praveen Garu.
Namaste, Jhansi. How are you?
Namaste. Great, Dr. Garu. So wonderful meeting you here as a COVID warrior and also a co-victor, I should say. And the positivity that you're spreading is amazing with your patients and with spreading awareness all around. So, Dr. Garu, you specialize in pulmonary and critical care medicine. When this news had come to you, what was your initial reaction?
I think one of the challenges we had is we knew all the facts. So, your mind tends to kind of go towards all the different aspects of the disease. But when you step back and look at it, it's a cold virus. The coronavirus is another cold virus. Unfortunately, the human body has not seen it before, so it's kind of reacting and fighting it the way it is right now. So most people actually do well. So you have to keep reminding yourself that 99+% of people actually do okay. There's no problems with them. So, no, I mean, it was helpful to have that knowledge that you could, rest that, because as a pulmonologist and critical care doctor, you know that most people will need very minimal intervention. They need to be watched, though, to make sure that they don't get worse. And I applied the same principles to myself.
Yeah. You being a TEDx speaker, I see that you have been a motivational speaker. You speak about remote critical care. And now Apollo Telemedicine brings this COVID care very closely to a telemedicine. How are you dealing with your patients on Apollo 247 app, Dr. Garu?
So I think, Dr. Pratap Reddy, our, founder, pioneer, he kind of set out several years ago saying everybody needs to get healthcare. And one of the ways to do that is to try to multiply the force by using telemedicine. We've been doing it for a long time. And honestly, while I was, infected and positive, I was actually more busy. Because I was actually seeing some patients from my quarantine location and actually managing them online.
Okay.
So we were actually able to do that. And we have set up at Apollo, for example, a separate unit for the COVID patients. And we are watching all these patients remotely and monitoring them so that if there's any emergency, we can deal with it right away.
Okay.
It's already connected around the country. So we are watching patients all over India, and we do this in a remote fashion. So, you're all familiar with Zoom now. So, and all kinds of telemedicine platforms. And from that standpoint, communicating with patients has become much easier. And as Sahadev shared earlier, it was really helpful for us to intervene, fairly early. I have also seen other patients through this particular application where in Calcutta there was a patient who was quite sick actually, and they had set up an online appointment. But when you took one look at him, you said, "What, you need to go to the emergency room." So they actually rushed him to the ER based on this quick evaluation. So I think the app has actually saved lives. We don't hear all the stories, but I'm sure many lives have been saved just by this video interaction that's happened.
That's right. Most of the time that we think physical interaction is the only way to deal. I suppose that's what we've learned doing all this while. Now we need to unlearn certain things and get accustomed to the newer technologies. Doctor, there's also one thing that I don't know if we are going to face another pandemic like this, but this pandemic has taught us so much. Watch out, be aware. But being aware is something and being in panic is something else. So how do I understand what are the symptoms to watch out for? For example, you, I suppose, were asymptomatic. And how does one understand?
I think one of the things is, in general, we need to pay attention to our health. We don't. In general, we're not fit. We're not doing these things. So I think the pandemic has really brought into focus that fitness is very important.
True.
And our diet is important. People who have, say, diseases like diabetes, they need to make sure their sugar is under control. So even the people with diabetes, hypertension who get infected, most of them do okay. But it's very helpful to have those parameters under control. So for example, in our own hospital system, in other hospital systems, you have all these programs to help manage your diabetes, manage your hypertension, take care of your health online or offline. And if you can control those things, your outcomes are much better. That's the first lesson I would want to share with patients or potential patients. The second thing is that in terms of the symptom awareness, in Corona especially, most people don't have any symptoms. I had very minor symptoms, really like a cold, flu-like thing. And I was kind of aware that I need to get evaluated mainly because of that, because the kind of job I do, you don't want to expose other people. But of course, the challenges are that you don't want to expose your family either. So there's a whole ritual that we do now in terms of, watch for your symptoms every day, check your temperature, check your oxygen level, for example. So these are all early indicators of something going on.
Yeah. So the other thing is when to isolate and when to quarantine and when to come into a medical emergency room. This is something where people are constantly looking for information. Sure. The oximeter thing that you had suggested, doctor. So everybody is right now having, if people don't have one, please go on to Apollo 247, order it right now. And I think this is one gadget which we all should carry always.
Absolutely.
And how do you think that this will help me to reach out to emergency room right in time?
Sure. Now the oximeter is a two-edged sword in the sense that you want to make sure that, you don't get wrong readings out of it. There was one patient who said, something wrong, nothing's showing, turn it on. Push the button to switch it on and make sure the batteries are okay. And then, when you put your finger, make sure there's not a lot of light exposed to it because this is a light sensitive device. Okay. And if you have nail polish, take it off. I don't know if you have nail polish, Jhansi.
No, I'm not, but then, yeah.
Good. So some kind of nail polishes won't work. And then you give it a few seconds to catch up. It's a machine like anything else. So give it about 5-10 seconds and then you get a steady reading. Anything about 94% is okay. If it's dropping, especially, I have a thing with my patients. I tell them to take a walk and check it every minute. And if the numbers are going down, then it suggests that your lungs are not getting enough oxygen. ऐसा होता है कि lungs का size actually stretch करे तो tennis court का size है. If you actually stretch human lungs up, and oxygen अंदर जाता है, carbon dioxide बाहर जाती है. So when you're actually doing that, if you have an infection, some part of the lung is infected, it's not working. So oxygen कम हो जाता है, and कितना कम होता है? As a medical person, you will know, okay, this is the level that it should not go to. Your doctor can guide you saying, go into the hospital at that setting.
Right.
And watch your temperature, blood pressure, pulse rate. Keep a tab of it if you're at home and isolating.
Okay. Dr. Garu, while you were home isolating, what was the ritual that you followed? You were mentioning, how do you take care of your family members?
I think some of this is scientific, some of this is common sense, some of this is probably just superstition. So, the thing is, for my house, for example, as you were mentioning, many people have a separate room that you use. Ours was a guest room. So I was kind of a guest in my house in the sense that all the food was supplied. And I must say, thanks to my family, the food quality improved a lot. Feeding me better food than I was used to eating. But the thing is, in that 10, 11 days that I was actually isolated, the door was probably open shut for not more than 20 minutes all put together. The door was closed.
Okay.
I had a window, kind of a balcony door, so I could get fresh air in. Anytime I opened the door, I shut off the fan. And then I was even putting things to block off the seal under the door so the air doesn't go out. So the virus, honestly, is a very tiny thing. It's, it's micro, it's not even micro, it's a nanometer scale. You can't even see it. So I don't know if it's, superstition that I did that, but the whole goal was do your best to avoid contaminating other surfaces. Every time we got things in, we would wash our hands. I actually, you became a bachelor again, where you kind of kept all your clothes together. You put your own bed, you cleaned the thing. I asked for a whole room, dust control. I had to get a mosquito swatter. So, you kind of remember what it was like before, and you also recognize the value of people who help you in your life. People who drive you or clean your house. I mean, all those things, you start recognizing there's such a value to that. You also have time to intro about what is important in your life. It's not like, this is like the end of the world or anything, but at the same time, you start recognizing that people are important, people in your family are important. You also recognize that if you're able to help somebody else, you take your mind off exactly what you're going through. So actually there's scientific evidence that if you help other people, you actually feel better even when you're going through stressful times. So I was able to actually talk to patients. I actually gave a webinar sitting in my quarantine room. I'm in the exact same spot that I was, a month and a half ago. So from an overall standpoint, quarantining is essentially about preventing infection getting to others. I would recommend that you make sure that you are exercising, eating a healthy diet. If you need to take medicines, take them on time. The one mistake I initially did was I watched a lot of Netflix, but that messes up your sleep cycle. Sleep is important,
Very important.
I hardly sleep, but the sleep is very important. So I would suggest you set a bedtime and a wake up time. And it's very important you try to stick to that, because otherwise the sleep cycle goes off balance and then, everything gets off. Your immunity also goes down.
Perfect. Doctor, can I now quickly ask, my live chat is buzzing with questions and I have not taken questions for a long time. So my first question is from Lalita, who's asking, one of her relatives had undergone a kidney transplant a year ago. What will happen if they become COVID positive? What should that relative do?
So I can tell you from direct experience with a patient of mine who had a kidney transplant, who got COVID. They should definitely get evaluated for going in the hospital, mainly because they may require a little more aggressive treatment. Now, typically with kidney transplant, as you know, by the way, transplants are very important. They save lives. So people who are, thinking of donating their organs, please do that, when the time comes. But in terms of kidney transplant, they're already on immunosuppression, meaning their immunity is already suppressed. So in a way, they're lucky because many of them are already on steroids. And we have seen that some patients need steroid treatment. So that way, for my patient, for example, I was able to boost up the steroid a bit, but some other immunosuppression you have to decrease. But everything else is the same. Watch the oxygen level, watch your pulse rate, and make sure that the sugar is under control if you have diabetes, for example. And talk to your doctor whether you should get admitted, because sometimes you need special medicine. Now, I use the app to actually talk to my patients and then triage them. There's one patient who did not need to get into the hospital, another one with a transplant, another one who had a transplant needed to get in the hospital. And I was able to recognize this online, and we can actually, verify that their pulse ox is correctly connected, check their pulse. And down the line, we're even getting technology where we can check pulse rates looking at the patient. We don't even need them to measure it.
Oh.
It's experimental, but those things are out.
Technology advancements.
It is totally out there.
All right. Doctor, the next question is from Divyusha. Even after a person is recovered, like lung infection and diabetes, there are many news about after effects, even after a person is recovered, like lung infection, diabetes. What are the symptoms that we should check? I suppose she's asking about post-recovery, is there a chance of spreading? Am I shedding the virus still?
Sure. So two aspects to it. Most people after 10 to 14 days don't get infectious. Even if your test is positive, it may be non-infectious, which is why the government of India has now recommended no need to retest, because the viral particle can make the test positive, although you're not actually having any infection. Second aspect to it is in terms of the effects of the disease. Some people can get lung injury. We do have colleagues of mine who have had lung injury who need medicines to decrease that. So you need to see your doctor, pulmonologist, or your general medicine doctor to see whether you need medicines for wheezing, medicines for treating the after effects of diabetes. The sugar goes up, you may need more aggressive control initially. So there are definitely a need for post-hospitalization or post-corona watching, and many things we are still finding out. So even now we are just learning about the initial wave of patients from China 5-6 months ago. We are watching these patients to see what happens to them. And luckily, the human body is very strong. God has given us a very, very strong system to combat the infection. Your immunity takes care of itself. Most of the stuff is just supporting. Your body is actually fighting itself.
Exactly, doctor. Two more questions that I would club together and ask. I have an 11-month-old son and extremely worried. Shweta is asking this question, and somebody also wanted to ask a similar kind of question. So how to take care of kids and especially toddlers?
Sure. So again, kids actually are not showing that many signs of infection. But it doesn't mean they're not infectious. They are spreading the infection to others, but they themselves are not showing infection most of the time, mainly because their immune system, they think maybe something called the T-cell immunity is very strong in them, and maybe that's why they're actually not showing signs. At the same time, since we're learning more about this process, I'm not a pediatrician, but from what I've heard from my pediatrician colleagues is that you have to watch for symptoms like anybody else. And in some patients, you may require medication. There are some very, very rare, unusual syndromes that happen in kids, but most people don't get anything like that. I really won't get worried. You follow the same principles, hand wash. So if you look at my Twitter feed, for example, a long time ago, I put this up where all you do is wash your hands, wear a mask. When you're talking to somebody else, make sure they're wearing a mask. And if you don't touch your nose and mouth. So just these simple measures that actually are sufficient. We hear a lot of these WhatsApp forwards saying, corona does this, corona does that, but it's another cold virus. You do the same thing that you do to prevent a cold. Touch your nose and mouth, wear a mask, wash it.
Okay. So as you give us these sanitation hygiene requirements, somebody is asking, Hiba Had is asking, how are people being infected in spite of wearing a mask and hand washing or sanitizing routine?
So that's a good question in the sense that how did doctors get infected? So what happens is you get infected in the community. It may be that you picked it up somewhere else. It's also important that you don't slip up your sanitation as well as your quarantining as much as possible. And many asymptomatic people are carriers, which is why it's important that you follow these rules everywhere. Now remember this, it's physical distancing. I don't actually like the term social distancing.
I know, physical distancing.
So, you talk to people, use a phone, do a video call, whatever, continue to stay in touch with people. And I'm just going to deviate really quick here in the sense that when I was in quarantine, people kept calling me, including, my hospital people, management, everybody kept calling and asking, how are you doing? And that actually helped. That really helps when you're in touch with people. It really helps. So if your friends are infected or family is infected, don't ignore them. This is not a life-threatening thing for most people. Don't distance them in your mind. You have to talk to them. You have to communicate with them, and don't discriminate. Very, very important, because we're all human beings. So it's important that you recognize it's an illness like anything else. It will pass.
Exactly. And I suppose Kanika ji, Sadev ji and Lalita ji would agree to this. And it's just any other illness that will pass. Okay, quickly, next question, Dr. Garu. Most of them will not get an idea. Narasimharaju Ditchpalli Garu is asking this question. Most of them will not get an idea to call Apollo. They'll be blank and panicked. We need to write how we can order not only medicines. Basically panic. We are all blank. So hum log to aise blank ho jate hain, we don't know what. So do you suggest that we have the app in hand and we look at the features, get convenient with the telemedicine portal?
Sure. So when I'm a critical care doctor too. So when I was training, one of my teachers used to say, when you're in a critical situation, the first thing you do is check your own pulse. And start taking deep breaths, slow down. Because you think clearer when you're, slowing your breath and breathing. Deep breathing is a good thing to do that. So I would recommend two things. So we are, as a country, we are not in the habit of preparing. So I would suggest that you keep yourself prepared with a simple plan in mind of what you're going to do. Have a discussion with your family saying, if one of us gets sick, this is what we're going to do. If there's an emergency at home, this is what we're going to do. And this will help you in any kind of disaster that comes through in the future. The second thing is keep an emergency kit available, like a first aid kit with, the important things like maybe a thermometer and a blood pressure cuff, basic medicines to decrease pain and fever, like acetaminophen, things of that sort. Keep that kit ready, and of course, sanitizer. So
all these are available, sorry to barge in, doctor, all these are available on Apollo 247 app. If you don't know what to keep and ready, there's a Kavach kit.
Oh, there's a kit. So I actually, through my, because I'm working in the system, I knew what's there. I called somebody and they sent me the kit. So I had everything I need in a little box. It came through, and I had a garbage bin, gloves, a little notebook to keep my temperature, keep those things in mind. And everything was there. I mean, except chewing. They pretty much had everything in it to kind of keep you busy, to take care of yourself. And that really helped me, definitely.
Yes, wonderful. Dr. Vasudharani is asking, is plasma therapy helpful or not?
Sure. So the data for corona is evolving every day. If you go to our website for clinicaltrials.gov, you will see that in the last 6 months, coronavirus has over 5,000 plus research studies going on right now around the world. Like that, our knowledge has evolved so fast. We have seen that plasma clinically has been helpful. The data is still being evolved. It is still in an experimental phase as a trial. People are getting enrolled to use plasma. Global data is definitely favorable, but we still need to know a little more information. At the same time, it's very important that those who have recovered, please go and donate your plasma if you can. Get checked to see if you have antibodies, and in our hospital, we have a blood bank. Most hospitals, the blood bank will actually handle this. Talk to the people there and get it. And if you've seen the recent videos on social media, there have been many celebrities who have been promoting. I don't know, Jhansi Karmi, CSRMO, but it's, I think, very important that you spread awareness. And once the corona thing is over, start donating blood, because blood is always in shortage. And plasma, actually, you get your blood back. You're just giving a little bit of plasma, you get most of the things back. So I think it's very important to donate plasma.
And how long can they donate plasma? How long after they have recovered? Or
4 weeks, 2 to 4 weeks. In emergency 2 weeks, generally 4 weeks is what they say. And most people can do it more than once, in fact. So you don't have to restrict yourself. And many of the places have now set up the system to actually do it quite efficiently.
That's interesting. Somebody's, I just missed the name. I'm not sure if it's a live chat which is scrolling, so I missed the name, but I remember the question. How long do we have to deal with the pandemic?
So, okay, there's a scientific way to look at it and a philosophical way to look at it. The scientific way is, honestly, we don't know. But the truth is that, in general, most countries, if you look at the WHO data, many countries have already peaked and it's starting to come down, but we probably will have to live with it. Now, as people get immunity to it, and as a vaccine comes through, it will be like any other disease. It's not going away anywhere, but the human body is going to learn it. If you have 30 seconds, I'll give you an interesting fact. Do you have, Jhansi? Can I just give you a scientific?
Sure, please.
So people have, there's something called, genetics and archaeology. So they've actually found old human remains, 60,000, 70,000 years old. And they've taken DNA out of it and they've amplified it and to see what is the genome. They very interestingly found that they are finding certain genes which are preserved between those human beings of 60,000 years ago and current human beings. And they found out what do these genes do. Found that these genes are actually fighting the coronavirus. The same genes are active 60,000 years ago are getting activated now in human beings which were not active before. So our human system actually has the ability to fight all kinds of viruses. One of the problems we're seeing now is that many of us are getting very sick because the system is acting over aggressively and damaging other organs. So we are giving medicines to suppress it. And the good thing about science is in the last 3 to 6 months, we have learned so much. It is impossible to even imagine. We now are talking about treatments which evolved within months. So we are actually in a much better position now to handle it. And the people who are getting very sick are the ones who already would have gotten sick with anything, not just coronavirus. Any kind of infection would have affected them. So overall, the pandemic will start getting controlled. It's already getting controlled once the immunity builds up, once we get a vaccine, and once we are a little better at the treatment. And every day new treatments are coming. So I would be very hopeful that make sure you're in touch with your doctor. Don't listen to all these crazy WhatsApp forwards which come with fake. Don't look at it. Just talk to your doctors and ask for the accurate information. We know how to take care of these patients. We have dealt with other patients similar illness, even very sick ones of what we call ARDS in the lungs. Very sick. We have managed these patients. It's not very different.
Okay.
One thing you can do is if you lie on your stomach, for example, your oxygen levels improve. Most people don't know this, but we have known this for a long time. So, Jhansi Garu, my recommendation to your viewers would be, number one, don't worry.
Yes.
Science is there to help you. And if you can build up your immunity through fitness, good sleep, good diet, and taking the medicines as recommended, I think you're in a good shape.
Perfect. And I can't tell you how positive and strong I'm feeling after that, the gene factor that you have just revealed. Seriously, it's a great revelation, and I'm strong. I want everybody else to feel the same strength within. Trust your body's ability to heal yourself. Wonderful. And there's a question here. How does the high-rise or the resident welfare associations, the communities that are living together, how can they participate in corona pandemic, and what should they be doing?
Sure. So I say I'm not sure what the systems are doing, but I know that as a provider, I have been asked to speak to some communities online, and I have given them guidance on what can be done. And I've actually involved parts of my hospital to help with this, where we can actually set up a system where medicines are given to them as needed. We can do online appointments, online consultation, as well as online discussions on how to do it right. Number one, again, I go back to the D word, don't discriminate. Now, if your flat member got it, don't, kind of shut them off and, barricade them and all that. Not needed at all. Make sure that they wear the mask, wear the protective gloves as needed. Try to stay in your own room. Let the resident welfare association have certain times when people can go out for exercise, for example, and make sure you maintain a 6-foot distance. Make sure that you're, further away from each other, and encourage people to have positive discussions through your own networks, where you kind of stay in touch with your neighbors. This is an opportunity for you to actually get to know your neighbors. Hardly when do we ever, open the door, shut the door, go to work, come back, get in, shut the door. Now there's the opportunity to actually talk to your neighbors and interact with them. And your resident teams, the welfare association, ask them about maybe talking to your nearby hospitals about if there's an emergency, can you have a setup where an ambulance can come guide us? Can you have your doctors talk to us? So this can all be done. And not just for corona care. I actually did a camp for a remote site for everything, not just corona, diabetes, hypertension, asthma, wheezing.
Yeah.
You can take care of that. And this is your time to get those diseases under control.
Correct, exactly.
Other illnesses. Yeah.
Dr. Garu, as you were pointing out for the resident welfare associations, Apollo does run a Safe Society program and also Apollo clinics at the society. All the ambulances, everything is at their doorstep once they connect. So that's a wonderful program I've come across in the last few weeks. Yeah. There's this question from Mr. I just missed the word. Ravi Peddi. There are conflicting ideas about using vaporizer or maybe a steam inhaler. Would regularly using help clean our lungs or disinfectant?
I just want to make sure that I understand the question right, but plain steam is fine. You don't need to add anything to it. Don't inhale nebulized vaporizers. They can hurt your lungs. People can die from that. Don't do that. If you're thinking about nebulizing a sanitizer and inhaling, no, definitely don't do that. Your lungs are very sensitive. Now, one of the reasons we're seeing the trouble with corona is because your lungs actually are fighting back, and that's why you're getting the problem. The virus itself is going and attaching and doing its thing, but your body, as it's trying to fight, is creating all the damage. So anything that you inhale can trigger trouble, and you may or may not know, but I'm a big anti-tobacco person, so it's very important you don't smoke. There is no data that tobacco helps anything, so make sure that you avoid smoke inhalation. Steam inhalation is okay, but no smoke inhalation.
All right. So there's another question from Rajini Sharma. I have COVID, but very mild symptoms. I'm recovering with your coverage plan. But what are the chances that I'll be reinfected?
So जो अभी का डेटा है साइंस में लग रहा है कि 99% पेशेंट्स का दोबारा इन्फेक्शन नहीं हो रहा है, but we are still finding the occasional patient who does get a reinfection, but even this people are not very clear about, meaning is this a virus that just remained on there and didn't go away? We have seen that also, but most people are not getting reinfected. Reinfection chance बहुत कम है, हो सकता है, but अभी तो it doesn't look likely.
Right. Padma Ravikant has asked a question. Lemon, is it useful? How good is it as a vitamin C supplement? And can I use it on a diabetic patient?
Yeah, so diabetes is not about not eating everything. It is more about regulating what you're eating. So as long as you can maintain your carbohydrate amounts and talk to your dietitian and your endocrine doctor or regular doctor, even online, you can kind of discuss about how much sugar you need. Lemon itself doesn't have any sugar content, so that's fine for diabetes. in general, lemon does have vitamin C. Anything with vitamin C, amla is very good, for example, or you can take a vitamin C supplement. It doesn't matter, juice of some sort. So all of these vitamin C supplements help. Now, again, the data about taking a multivitamin is fairly general. There's no evidence that taking a multivitamin is going to make you not get corona. But why you want to do that is to keep your immune system at its prime, to make sure that there's no nutritional deficiency. So from that standpoint, I think it's important to use these things.
Wonderful. Doctor, on a closing note, thank you so much for being with us, being an expert in the field, being the COVID warrior to the COV-ictor. Thank you so much. This journey has been amazingly inspirational. Thank you. And one last word from you, Doctor. For you.
So I think, Jhansi, I think the colleagues are online, Sadev, Lalita, and Kanika. You guys have gone through it harder than me. I mean, mine was obviously, and I know colleagues who have actually suffered through it quite a bit. So one of the requests to the public is, give the doctors who are taking care of you a little bit of a thought and their prayers, because they are actually going up to the front lines, and honestly, it can be challenging. So please give them a little thought and prayer for them. The other thing, of course, is that do not despair. This is a cold virus. Your body can handle it. Don't worry.
Wonderful, Doctor. With that positivity, I take leave from you. Thank you once again for this valuable time.
Thank you. Thank you.
Thank you so much. I request Dr. Garu. Thank you so much, Dr. Garu. And one quick thank you to all my participants. I'm now going to get into my quiz questions. Thanks, Dr. Garu. I request you to switch the video also off. Yes, now your time to participate in the quiz. My first question for today, please type the answers in the chat box. The first question is, what feature on the Apollo 247 app allows you to take the coronavirus self-risk assessment? Which is that feature which allows you to take a self-risk assessment? If you don't have the answer right now, download the app, check which is it, and type chat box में मुझे answers मिले हैं या नहीं मिले, मैं देख रही हूँ आपके answers. Okay. Question number 2. Before I go to the question number 2, answer type कीजिए answer को chat box में, and winners will be announced towards the end of the show. And you have to, if you are a winner, you have to write to us at marketing@apollo247.com to claim your prize, and the gift will be delivered at your doorstep. My question number 2 for today, what is the speed of a sneeze? ठीक है, what is the speed of the sneeze? पता है तो immediately type कीजिए chat box में. Question number 3 coming up. Red blood cells are produced in which part of the human body? Go on, quickly type your answers. There are 3 questions that I asked you now, and I'm looking for 3 good winners. So in the meanwhile, I see the answers are coming in. Yes. A lot of people are typing their answers. Priyanka 15, you say Kavach. I don't think Kavach is the right thing. Go again. Priyanka 100 miles. Rajesh, Madam Setti, Kavach plan, not right answer. Go type again. Okay. Ranjit, you say check your risk level. Let's see if that's the right answer. So a lot of people are answering in the chat box. Please send in your answers. Before I leave, I just wanted to show you the pulse oximeter and how important it is. We just saw Dr. Garu telling how to use this. I have a quick factoid AV to be played. Let's have a look at this.
Some viruses can cause hypoxemia, leading to lower levels of oxygen and may cause breathlessness. Early detection of hypoxemia is essential to avoid critical conditions later. Easily keep a check of your blood oxygen levels at home. Pulse oximeter, easy, convenient, and safe.
You can order your pulse oximeter from Apollo 247. And the winners are Priyanka 15, Ranjit Mangamuri, and Nitin Agarwal. Congratulations. Please collect your gift. You have to write an email to us and collect your gift. And thank you so much, all the participants who have been with us today. Great spreading positivity, and I hope you have derived, people who have been watching this webinar with us, I suppose you have derived some strength from our COV-ictors. Thank you so much for being with us. As a small gesture, Apollo 247 is giving out gift coupons. Please use these coupons on Apollo 247 app. Use this coupon Apollo247 and you can get a rupees 299 off on online consultation with Apollo doctors. And the second coupon which we are giving out today is a discount coupon, Medicine10. You can type this on Apollo247 app and get 10% off on pharmacy orders. So that's it, folks, for this week. Next time when we meet you in Health Hour, we are going to promise you that we'll come back with more expert advice. Tab tak, please stay safe, take care of yourself. Bye-bye.